Welcome to the Vital Living Forum. In the United States, approximately 2/3 of older adults will experience at least two challenges of daily living during their lifetime, including challenges with getting dressed without assistance, bathing, eating, or personal hygiene. Yet the thought of a medical crisis or needing help completing daily activities of living is probably the furthest thing from your mind. But as we age, the odds of needing help rises. Today's Vital Living Forum focuses on how to select a residential care facility that fits your unique needs. There are many types of residential care options, including skilled nursing facilities, assisted living facilities, continuing care communities, or adult family care homes and group homes. Because a placement in a care facility often occurs after a medical crisis, we'll begin today's discussion from the standpoint of an elder being in a hospital setting and needing discharge into a supervised residential setting. Joining me are our special guests, Lou Marie Leviska West with Florida Health Care Association and Tom Campbell with Tom Campbell and Associates. I also would like to welcome our studio audience. I'm Serena Fisher, and let's get started. Lou Marie, tell me something about yourself.
Well, I'm the Senior Director of Policy for Florida Health Care Association, and we represent approximately 85% of the state's nursing homes and also a large number of assisted living facilities, more of the larger ALFs in the state. And by volunteer work, I'm the president of the Florida Council on Aging, which represents the membership of home and community-based services providers in the community. And I also do volunteer work with the Big Bend Hospice group.
You're definitely a busy woman.
I enjoy long-term care.
Good.
But I'm also a grandmother.
Oh, okay. Tom, tell me about yourself.
Well, Serena, I have over 25 years experience in long-term care, primarily in residential care, and I've worked with just about every population there is, including the elderly, Alzheimer's, dementia, mental health, developmentally disabled adults, and even some traumatic brain injury. I've spent the last 11 years teaching the ALF Core Training certification class for ALF administrators. And I currently operate my own companies, continuing to do training and consulting and management services.
Well, we feel very fortunate to have both of you experts with us today to help us walk through the decisions that one must make in trying to determine the best decision for long-term care. And as we mentioned in this segment, we are focusing on someone who has been discharged from a hospital and must immediately go into a setting for care. And I want to know, Luann, what is a typical scenario?
Well, if the decision has to be made quickly, oftentimes someone is in the hospital and if they've had a 3-day stay in the hospital, they're eligible for Medicare coverage of up to 100 days in a nursing home. But if the individual in the hospital does not qualify for skilled care, then if they need help with assistance in daily living, they will be looking for an assisted living facility in the community. And oftentimes that means that they're looking within the locale where they or their family lives, and they want something that is someplace that is close in proximity. There's not a lot of time to make a decision, though.
And we will be coming back to that because often time is a real factor.
One of the key factors on making the decision on going to a nursing home or a long-term care facility like a nursing home, or the difference between going to an assisted living, is going to depend on the level of care and services they need. If they're looking at more nursing and medical services of the rehab type variety or rehabilitation, then they would be going to a skilled facility or a nursing home. If they were looking for a 24-hour supported living environment like assisted living for people to be there to meet their needs whenever they have a need, then they would oftentimes choose an assisted living facility.
Now, how much leeway does a family have? The hospital is making this recommendation, and how much leeway does a family have? Lou Marie, what is your experience?
Well, it's the doctor, the attending physician is the one determinant that really drives the decision-making process in terms of placement, because either for the assisted living or for a skilled nursing facility, the attending physician will make the recommendation. But if managed care is involved, they will be an important determinant as well in conjunction with the attending physician. And of course, the family. The family will be involved. Oftentimes, we hope, if there is family available or friends, to help the individual, because they're usually in the hospital being discharged. They're at an uncertain stage. But I do want to point out that 84% of all admissions into a skilled care come directly from the hospital. And so it does come at a time when you can assume that there's not much pre-planning for that. So there are variables that have to be assessed, and you have to know, though, who's making those referrals and who's making decisions.
Well, now, speaking of decisions, Lou Marie, let's say the family says, we want to care for our family member at home. And are there any guidelines for that?
Well, again, the attending physician is the major determinant of whether or not the family can provide a safe home environment. And I noticed that in our audience today, we have protective services for adults who are here with us today. They play a very important role. If there's any concern about neglect, for the individual, if they go home with inadequate services and they're at risk. But of course the family would be, I'm sure, cognizant of that and wants to ensure their loved one is placed safely. But there's oftentimes the intent of an elderly person is to go home. That is their desire. They want to go home, and we all of us in long-term care understand that.
Yep.
Now, if residential care is the decision that should be made, Tom, review the various options that we have.
Well, other than skilled facilities or nursing homes, then we have assisted living facilities. And currently today in Florida, there are about 3,000 assisted living facilities licensed to provide care. Of the 3,000 plus assisted living facilities in Florida, about 2/3 of those are 25 beds or less, with another 40% being 6-bed homes. So there are a lot of ALFs out there that people aren't aware of, especially the smaller homes that don't really have the sign on the street. From there, you would go into looking at adult family care homes, which is another licensed facility by the state of Florida that licenses up to 5 beds, and the provider or licensee must live and reside in the home. So the caregiver actually lives in the house that is licensed. And then group homes are typically what you would find for people who are under mental health type of programs or developmentally disabled adults. So it really depends a lot on the individual itself, their diagnosis, the level of care that they may need.
But you are saying something that keeps ringing with me, licensed, and that would be something that you definitely would want to be looking for.
Yes, ma'am. Definitely licensed homes would be the way to go, though the state does allow people to care for up to 2 people in their own home they live and reside in without a license.
Oh, okay. Yeah. There can be a difference between timing between a safe discharge and going into a facility and finding a permanent facility. Is that correct, Tom?
Yes, there is. Optimally, the more time you have to do your research and to go out and look for the potential placement, the better off everybody is. I like to think that discharge planning starts on the day they're admitted to the hospital or even to a nursing home or a skilled facility, which gives people and the families and everybody time to go out and really do a thorough search of what they're looking for.
The key is finding the right placement for your family. And where do you suggest that families begin their search, Tom?
Well, it's amazing today, after being in business or in this profession for 25 years, the internet is a powerful resource to people. You know, quite commonly you hear people say, Google it. And indeed, you can pretty much Google every resource known to man, but there are lots of resources out there available to seniors and for families to look for information. For example, the Agency for Healthcare Administration, who we professionally all call AHCA, they have a website called Florida Health Finder, where you can locate providers statewide, look up information. You can even go in and pull or download off their survey reports for their last inspection. So there's a start there, and then there's the Area Agency on Aging's that are out there that have senior helplines, and we even have a lot of private organizations that are placement services or referral services that are allowed to work with seniors and families, as well as the geriatric care managers and the social workers that work out in the community.
And we're going to be talking about that a little more in our next segment. But Lou Marie, just tell me, from your standpoint, what do you think a person should keep foremost in their mind when considering a facility?
I think that, and I'll just talk about my personal experience.
That sounds good.
With my dear father. He did depart on August 27th, 2013, at almost the age of 99. So I have some experience with my dad, and a couple of times where I had to work with the care managers and the attending physician in the hospital for a placement, for a skilled placement, I would go to the nursing home. I also looked at the Agency for Healthcare Administration's website. Even though I work with nursing homes on a day-to-day basis, I see what is the latest star rating and what their survey said. But I went to the nursing home and I talked with the administrator and the director of nursing, and I walked through. You use your senses, you see how the people are interacting, you smell, you look at the food and taste. That's very important. So just to get a feel for the facilities and do a comparison, but always it's based on what's available.
What's available, and also, Tom, don't finances come into it?
Well, unfortunately, the finances do drive the car, so to speak. The more financial resources you have, the more options that you have available. The least financial resources you have, the least options you have. So, since assisted living is primarily private pay business, meaning people pay out of their own pocket, it certainly factors into where people go.
Just very concisely, Lou Marie, what is the difference between what Medicare and Medicaid will cover?
Medicare is for skilled nursing. It will cover if you've been in the hospital for 3 days or more for a skilled nursing service, acute care service, you are eligible to go into a nursing home, skilled nursing facility under Medicare for up to 100 days. But in a nursing home, the typical population is trifurcated. You have a third that is there less than 20 days, a third of the people in a nursing home are there less than 20 days for rehab services. Another third is there for less than 6 weeks. And then a third is the long-term population, the typical Medicaid population, because Medicare will only cover up to 100 days. And then Medicaid comes in and will, if you're eligible for Medicaid in the nursing home, it will pick up the copay under after day 20 under Medicare to day 100. Okay, and then after day 100, then Medicaid could take over. But to become eligible for Medicaid, you can only have, if it's an individual, you have to reach the ICP, Institutional Care Program, which is 300% of poverty. And you may only have $2,000 for the individual or $3,000 for the couple, unless it's a spouse in the community, and then you can save $117,000 for the spouse in the community. It's very complex.
It sounds that way.
It
I
is.
know at some point, Tom, doesn't your private insurance and your long-term care kick in?
Well, when you talk about private insurance, if they're a Medicare supplement or some type of health insurance, typically for assisted living, you wouldn't see them paying for that. That would be used to cover other costs under Medicare and other medical expenses. With Medicaid, it's a whole different ball game in assisted living, because Medicaid does help pay for assisted living, but it's a very restricted, and the accessibility is very difficult.
And it sounds as if that would be a topic for another discussion.
Yes, it would be by people other than myself, I'm sure.
It's time now for us to take a short break. And when we come back, we will look at how to select a care community to fit your needs. Welcome back to the Vital Living Forum on Residential Care Communities. My guests today are Lou Marie Polifka West with the Florida Healthcare Association and Tom Campbell with Tom Campbell and Associates. And of course, we have a very distinguished audience. In this second segment, we'll discuss the hands-on research that families can do when selecting a care community for their family's needs. And Tom, I'm going to start with you. Why is it important to find the right long-term care facility at the very beginning?
Well, as I tell people who ask me that question, if it was me, I would like to look for the right place the first time, because when I move my mother or my father or a loved one into an assisted living facility, I want to make sure that I only have to do it once. We find that if we have to make multiple moves, that's not good for my mother, and it really disrupts the whole flow of care.
Well, Lou Marie, how do I know what is right for my family?
That is a very difficult question, but I think it's a very important one for every family to consider at the point of looking to the future for their family member, hopefully before they have had to go into the hospital, as we talked about previously, and they're looking at a placement very quickly. So if the family has looked in the community and know what resources are available in terms of whether it's independent living or assisted living, or if it's going to be a skilled care community, I think it's important that they be informed. And so they look at the options of what is available. They request the package, especially assisted living facilities and nursing homes will provide a package upon request with a list of the charges, what's available, and they will give information in terms of bed availability or apartment availability, what is there in terms of shared space. That's another key question. You know, how is the person going to adapt to having a roommate possibly for the first time since maybe their spouse died, or they were divorced, or they've never been married, and they're to consider living with someone in a shared room or a shared apartment. So there are different questions that have to be looked at in terms of the space and what's available and what the family feels is affordable, again, with the individual that is looking, and it has to be the individual's decision. If they're cognitively alert and aware, then it's their decision. It's not the family's, really. So that has to be critical too.
And we have used the term family. Now, does that mean everyone in the family or only the person who has the medical power of attorney? What is your recommendation for that situation?
It has to be the whole family, if possible. But in the world of long-term care, there is always, in Florida, there's the daughter who's over in California who only shows up when a decision has already been made and decides there's something else that should have been done. So that's just the way we deal with my daughter or a son who has not been a part of the decision-making process, and then they come and they want to be a part of it. So we understand it's important to have everyone, don't you agree, Tom?
I
Have
agree
everyone
wholeheartedly.
involved in this.
In fact, the more discussion that can take place on the front end with family and and between the facility and the individual who's going in, the better off everybody will be. And as I tell everybody, due diligence on the front end saves you a lot of trouble on the long run.
Well, going along that same line, Tom, how many visits do you recommend, and when do you recommend that people stop in to check out the facility?
Well, you know, I've thought about that, and I would tell you probably a minimum of 3. You're going to have the initial visit that you're going to go out to do your first discovery, and that's when you walk in the door of the community or the assisted living facility and do the sight, smell, and all that and see what's going on. It then would be a good idea to sit down and meet with somebody who represents the facility, make sure you get all the information that you need on the front end, and then I would drop in unannounced during a mealtime.
Okay.
Look at the activities calendar when you're during your first tour, see when most of the activities are occurring, and maybe show up then.
And Lou Marie, what do you think are the key things to look for on that visit?
Well, with my father and my mother, this was 7 years ago when we started looking at an assisted living facility. And we talked about it for 2 years before my brothers and I, and with my parents, decided that it was time. My dad was at that time 91. My mother was 83 with Alzheimer's. And it became incumbent on us as the children to encourage them to move from their home and into a place where they would have ongoing assistance throughout the day, because I work and my brothers work, and we wanted them close to us, however, and it seemed the right time. We made the tours, but then we also took my parents and we took them at a meal function to look to see what was going on in the facility and where they felt comfortable. And we thought that was a good way to help make the decision and to help them understand that this was going to lighten their burden of each day, thinking they had to take care of one another. And so they would have someone else preparing the food, someone else cleaning their apartment, and that was the transition we found was helpful.
Release more time for them to enjoy each other's company.
That's correct, yes.
Now, I've heard people say that you can tell a lot before you even go through the door. What can you tell as you approach the building, or even as you make that telephone call to make the appointment?
Well, the phone call's important right off the bat. First impressions make a difference. And a lot of people, the complaints that I hear from consumers and people who are looking for placement is the person articulate? Do they have information readily available? Are they willing and cooperative to provide you with information? Or are they just fielding a phone call? And then from there, it's doing any kind of research you can get from looking online and some of the resources that would be available to prepare yourself for when you go to visit. And then when you do go to visit, I always, even though I'm not a consumer, I always check out the neighborhood. I look to see, is the lawn kept well? Is it maintained? Is everything neat and clean? What about the cars and the bus in the parking lot? I mean, small things that make a difference.
The dress of the people working there.
Correct. Dress code and staff and how they're dressed and how they interact is very important.
Now, when you make your appointment, who do you want to talk to when you go to check out?
In an assisted living facility, it's the marketing director usually that is tasked with that, but I would suggest asking also to meet with the administrator and whomever is in charge of, if it's in assisted living, you can have, for example, an extended congregate care license so that the facility can care for individuals as they age in place with a higher level of care. If so, then I would ask to speak with the nurse in charge and to see at how comfortable they are in terms of at knowing how to explain your family members' health care concerns and how they will be responsive to the needs of your loved one, and what kind of staffing there is available. There is a minimum staffing in Florida, so you want to compare that with what is required to what is the facility has.
Are there any particular questions that you would want to ask when you go in to make a decision about a loved one?
Well, my first question would be, what does it cost? And
what does that include?
yes, and what does that include? Because they do, every assisted living is different. Some have a all-inclusive rate, others have a base rate that charge levels of care. Theory being that as your level of care increases, you pay for additional services based on that level of care change.
And Lou Marie, you have had on-the-line experience checking out facilities for your parents. What were the questions that you found most helpful to ask?
Since my parents had different levels of care needs, my dad, even though he was almost 92, he had just given up his driver's license, which, by the way, he said that was the worst part of aging, was giving up his wheels. Yeah. But I think the task was to see how the assisted living facility would respond to their needs differently. My mother with Alzheimer's had more assistance needed. My dad was much more independent, but my mother depended on my dad always being there. And so really she did not require that much more assistance because my dad did that care. But after she died, that was 4 years later, my dad became more infirm. He moved to another facility, which was closer to me and my brother. And over time, over the 3 years he was there, the cost increased quite a bit as in accordance with his needs. And by the time when he did pass away last summer, his rate of care was actually almost equivalent to what a nursing home would cost. In terms of cost, since we're talking about that. Right. So I think that the families and the individuals looking at long-term care have to be aware that cost is a very important concern in terms of what it buys you, what it gets you, and what, as the needs increase, what are you going to be able to meet those needs.
Well, now you have visited, perhaps you've had a meal in the dining room there with residents. You have observed residents. Maybe you've talked with other families who have family members there. You're pretty serious about this long-term care facility. What documents should you ask to see? You want to comment on that, Tom?
Yes, the regulations that govern licensure require assisted living facilities to provide with prospective or potential residents and families with what they call an admission package. And the admission package includes a wealth of information about the care and services. It would include a contract with all the actual financial responsibilities. It'll talk about things like advance directives and DNR orders and or do not resuscitate orders. Just a variety of information that all ALFs are required to provide prospective residents and families before admission.
But now, what about any documents that are sort of reports on the facility, evaluating the facility? Are they available to someone who is considering placing a loved one there?
Yes, at both the assisted living facility and the nursing home, skilled nursing home, are surveyed by the Agency for Healthcare Administration. and it's on their website, aca.myflorida.gov. We can put that information, make that information available, but that's where you can access the survey, the most recent survey from the state on any facility. But also, they have for nursing homes, they have Nursing Home Compare, which is at the federal level. CMS, Centers for Medicare and Medicaid Services, has the 5-star rating based upon staffing, survey outcomes, and also the quality indicators. There's not as much information available for assisted living facilities, however. It's just the survey that is available, but also the facilities are supposed to post these. And so if you go into a nursing home or an assisted living facility, you may ask to see where the survey is posted.
Now, we have mentioned dementia, Alzheimer's, and so forth. What should I be looking for if I am checking out and I think this might be a possibility that my loved one has?
Well, if you're looking for a facility for people with memory loss, Alzheimer's, dementia, I think the questions would be, are they secured? And when we talk about secured, that means that the perimeter is controlled by perimeter control devices that are tied into the life safety system, so that effectively the doors are locked, but if the fire alarm goes off, there's a 20-second delay and people are allowed to egress. If you have somebody with Alzheimer's, dementia that's prone to wandering, that's one of the single number one problems that we're faced with in the assisted living when we're dealing with that special population of people. At what point does my loved one need to be in a secured facility?
I also think that whether it's an assisted living or a skilled nursing facility, the family and the individual who may have Alzheimer's or related dementia, you will want to look at the use of antipsychotropic drugs because there is a national and a Florida state goal to reduce the use of antipsychotic drugs by 15% in 2013 and now in 2014 as well. Florida reached that goal in nursing homes this past year almost. It was at about 13.8% reduction. We are still working on that. The way to reduce the use of antipsychotropic drugs is to look at the behavioral programs that you have in a facility and to train the staff appropriately to use other means of interventions besides drugs. Approximately 40% of individuals with dementia are having those kind of drugs at this point in time. That's why the goal is to reduce them. So you want to have a public that knows
Is
to
aware.
ask. Yes.
Thank you very much. I'm afraid we're going to have to stop and we're going to take another break. But when we will return, we are going to focus on how to successfully transition into living in a care community. Welcome back to the Vital Living Forum on Residential Care Communities. My special guests are Lou Marie Polifka-West and Tom Campbell. And of course, we do have a very fine studio audience. In this third and final segment, we'll look at how families can help someone successfully transition to communal living. Now, we have been through some of the things we might want to consider in trying to select a long-term care facility or assisted living facility, and now we're ready for the moving day. Lou Marie, help me. What do you suggest that you do to make the official moving day a little less stressful for all involved?
Well, let's pretend that it's been well planned. The decision has been made with the individual, the family member, and the family. All of the family members have met with their loved one, let's say their parents, And they have had a session also with possibly a legal attorney, a law attorney has come in and met with the family and with the parents, and they have looked at their advance directives. And we did this with my family, my brothers and I, with my mom and dad, and we had my friend Twyla Sketchley, an elder law attorney in Tallahassee, and we all did our advance directives. And we looked at, and my mother, who was already, who said, she had been diagnosed with early Alzheimer's, so she was still capable of decision making and looking at what she wanted with her memorial service, for example. When she wanted a DNRO, she was a longtime nurse and had retired. And my dad, the same way, he did not want extraordinary measures if he had a terminal illness. And each of us did that, and it was a 2-hour session that was very well spent for each of us, that helped in making that decision when they went into the assisted living, because they were asked for that. And we also worked together to downsize their personal items. That took 3 months with my brothers and I going through the house, and we made it a party with my parents. We would bring sandwiches or whatever meal we had every time we worked on the house and made them a part of it, how to make the decision on what they wanted to take to their new apartment. It was a new beginning, and that's the way we presented it.
Oh, that sounds like the ideal way, if only all families could do that. Now, Tom, what do you recommend in making the new setting seem like a new home?
Well, I agree with you wholeheartedly. Having being able to bring your personal possessions and surround yourself by all your memories is very important, even though we know you're doing a downsize through the whole process. I think the other part of the transition is to deal with the family as well, because we have the individual who is going into the residential community, but we have the family members who are going through the whole process of placing their loved one in there, and there's always a lot of emotions and feelings there that the assisted living facilities have to be aware of when they're dealing with that. So from an assisted living standpoint, if we can make the transition as comfortable for the family, understanding they're dealing with issues like guilt and all that emotions that go along with it, I think is very helpful on the day of move-in.
Should I be talking with the staff at the facility about my loved one's schedules, food preferences, and maybe their hobbies? What do you think, Lou Marie?
I think that it's wise to know the term care planning. Even though that is a term that's used in skilled care, skilled facilities, it's a requirement under the federal requirements with Medicare and Medicaid. It's a very good term also for assisted living, or it could be called the service plan.
Right.
And to ask for that time before your loved one goes into the assisted living, to have time with the activities director, with the food services director, with the nursing, whomever is there in charge of nursing, and the administrator, to have a joint session to develop that service plan and explain what your expectations are, and hear what the facility can say to you and how they will respond.
Now let's go to that day of moving in.
Okay.
What do you recommend for that day?
Wow. I would imagine the more family you could have, depending on the circumstance, to be there on the day of move-in, as much time as they can spend with their loved one that day, maybe having a meal or planning a family meal there with the facility, and any good ALF would arrange that for you, making it a whole group effort, and like what you said about how you had everybody together and the transition and downsizing of the house, making it a family event, I think would be very helpful.
Oh, one other point I failed to make is if there is a pet involved, I think that's an important consideration.
Yes.
My parents had a cat, Callie, who's now living with my brother, and Callie's been with the family for 16 years.
Wow.
And she helped in that transition, both in the first assisted living and then to the second assisted living. And when my father was dying at the end in this rehab center, we took Callie to visit him there. And so that pets are very important.
Yes, they are. They're extended family members.
And I believe there are some facilities that do permit individuals to have pets. Isn't
Yes,
that
they
correct?
are. Some do, some don't. The regulations allow assisted living facilities to have their own rules to say whether or not they allow pets, but most facilities today allow pets to some degree.
Well, let's change from a couple moving in to someone moving in and now having a roommate for the very first time in maybe decades. Any suggestions on how that might be handled?
Yes, I think this is a very important question to ask before the move-in and to find out how the selection process is made. That's determined within the facility, and it's usually based upon availability. And if it's a male going in, they're going to have less options because you have, I think it's approximately 70% of the persons in a long-term care setting, whether it's assisted living or a nursing home, are female.
Yep.
And so you're going to have more options if it's a female. And so that just is a fact.
And I think one of the best things to do if you were to share a room and if you have the ability is to take your loved one over to visit, get to meet who that prospective roommate will be, maybe spend the day or half a day. And it's a very difficult situation. I know my dad didn't want to have a roommate, and he made any roommate he had their life a living hell. So it was quite interesting. He was a real challenge.
Now, you mentioned the term visit, so let's switch gears a little and go to the idea of visiting our loved one in the setting. And what do you consider a positive and productive visit, Lou Marie?
When it begins with a big smile and it ends with a big smile, that's a very productive visit. I do think that the more that one can visit, the better. But you will find that some assisted living facilities will, I have been told, will advise the family not to come too often in order to allow their loved ones to become acclimated to the setting and to the staff and to the people. So you have to make that your own decision on that, though. I think you know best. You know your loved one best, and you can tell what is better for them in terms of your visits. But certainly, as frequently as possible. People don't visit enough, you will hear them say, but a lot of families do. I think actually 85% of the caregiving and is done by family members. Sometimes it's at a distance, sometimes it's directly visiting, but the phone calls are also very important and a wonderful form of visit as well.
What are topics that should be avoided when you're visiting? Or are there any?
Do you like this place?
Stay away from that one, right?
Well, that's a loaded question.
Yeah.
But I think it's a valid question. And, you know, to say a little bit about what you were talking about, a good facility would be able to work with the family to say how well their loved one's transitioning and how many times they should visit. But, you know, I think basically just ask the normal. I would treat people the same as I would if they were in their house. It'd be the same routine conversations that I would have with my mother if she was at home or if she was in a facility.
Now, as professionals, from your observation, what are some of the concerns that you have seen that families have about their loved ones in the setting?
I think the main concern that I'm aware of is whether it's assisted living or in a skilled nursing, the expectation that there would be more staff time with their loved one. Because of the requirements to provide different levels of care, you're going to have different levels of time that people do spend with their loved one. And so if you ask your family member, how often have you seen a certain staff member, and if they tell you that they haven't seen them today or that no one's been into their room, you're going to be concerned. And so that's one of the critical points of concern. And if you have complaints, for example, to the Agency for Healthcare Administration, oftentimes it's related to staffing. We never feel that enough staff spend enough time with our
our-
loved ones. Yes.
That's true.
Well, now, if you really do have a complaint or a concern, who should you address?
Well, if it's with the facility right off the bat, you should be directing that to the administrator. The regulations require us to have what they call a grievance policy for people to submit complaints to the administrator. And once we're past that, if they're not resolved, then we're all required to post phone numbers for state agencies to lodge complaints. And we have the Agency for Healthcare Administration, we have Disability Rights Florida, we have the Ombudsman, the Long-Term Care Ombudsman Council, and there's also 1-800-96-ABUSE, which is the abuse hotline. All of those are options, which are actually posted and required to be posted in facilities and accessible to residents.
Well, now, if you feel that you have a major complaint and it is not being resolved, should you consider moving your loved one from the facility?
I think that depends on what the complaint is, and whether or not you feel that your loved one is at risk of endangerment or whatever. I mean, it depends on the problem that they're facing. If it's something that that could be possibly handled, I think that the disruption is such a hurdle that you want to try to avoid that as much as possible. We know from all the experience that we have had with disasters, for example, in Florida, and evacuations, that the transfer trauma is a reality. There is a problem with transfers, and so you want to diminish that as much as possible. But there is one point I want to make. When you talked earlier about whether or not the first placement should be the placement that the person stays, I just want to make note that if a person goes into a skilled nursing facility that has Medicare and they don't have Medicaid, that if they go in and they use their Medicare days and they don't have Medicaid beds, they may have to leave to go to another facility if they're not duly certified. So I do want to make that note that families need to be aware for either skilled care or assisted living, what kind of facilities they are in terms of coverage.
And I would also, I'm sorry, I'd like to also add that one of the best questions a family could ask before they go into an assisted living facility is, at what point, if my mother or my loved one declines, will they be forced to leave and maybe relocate to another facility? Because some facilities under the extended congregate care license can allow people to age in place and live there and even die there under certain circumstances.
Very good. Well, we're going to need to take a break. Before we go to questions from our studio audience, we are going to take a short break. Welcome back to the Vital Living Forum. We have been discussing residential care communities and how families can select a care center and also make the transition. Now we're ready to turn to that wonderful studio audience for questions they might have on this topic. Okay, studio audience, who has a question?
My question is, do you have any tips for transitioning from Medicare to Medicaid or Medicaid to Medicare? Sometimes I find people who fit into one category and not the other, and they need care.
Yes, that is a very difficult gap to be in. If a person is 65 and older, or they have a disability that makes them eligible for Medicare, they will be eligible for long-term care, not really long-term care, it's skilled nursing care for up to 100 days in a facility. Usually it's a skilled nursing facility, or it could be in the home under home health, could be brought in as a skilled Part A or a Part B service. Now, if they need Medicaid for institutional care, and that's the ICP program, that's totally different because it's based upon income and assets and then level of care. But the income and the assets come first, and it is targeted to those that spend down to low income and who have spent down their assets to no more than $2,000, but the home is protected. The homestead is protected as long as there's a statement that the person could be able to go back home. So there's a lot of difference between Medicare and Medicaid. Where they come together is usually in a skilled nursing facility when the person has come in and they transition from Medicare to Medicaid because they've spent down.
And I would advise anybody to consult with an elder law attorney, and that falls in their realm, and they should know the ins and outs
Yes.
of wading through or going through that whole process.
Another possibility is to look on the DCF website for the SSI 2014. It's a little booklet of 10 pages that describes all of this.
Very good. Thank you. Another question.
You both talked about Medicare and Medicaid and long-term care and private pay. Are there other resources out there for families to help with aid and dependence, like VA benefits for assisted livings, and/or do those also help in a skilled facility?
There's one program that is called VA Aid and Attendance, which is what's considered a special pension program through the VA. And it's a program available to war veterans, dependent spouse, or war veterans, surviving spouses or dependent spouses of a war veteran. And based on financial qualifications as well as a medical qualification, the VA makes available funding to pay for what we call out-of-pocket medical expenses. And those are those expenses that aren't covered through Medicare, Medicaid, private insurance, long-term care. The big mistake with aid and attendance that people make is that when they call the Veterans Administration up, they'll say, hey, I've been told that the VA pays for assisted living, and technically that would be no, they don't.
Right.
They pay for out-of-pocket medical expenses, which, by the way, assisted living is part of.
My own father was a World War II veteran, and he was a recipient of the aid and attendance, $1,700 a month, and that really helped in his long-term care costs in the assisted living.
Yeah, and we find more and more assisted living facilities are asking that question. I've known of the benefit since 1996, and so it's something that I've had as a tool in my resource toolbox for many years.
Well, unfortunately, we're about out of time again, but I would like to give each of you an opportunity for any final thoughts you have on transitioning into a care community. And also, I'm going to ask if you would please give a contact number or address where the viewers might reach you. And Lou Marie, we'll begin with you.
Thank you. This has been a pleasure to be with both of you this afternoon. I would like to tell the Floridians who are watching this program that we're in this together. Florida is the oldest state in the country. We have the largest percentage of elders in the country. We also have one of the lowest number of nursing home beds per 1,000 elders in the population. So what it means is that families are so important in the role of caregivers. Assisted living is a growing part of this long-term care continuum, and nursing homes are being used as only for those that are really ill and are acutely ill and need that level of care. But it's also for individuals who are in the end stages of dementia, Alzheimer's, and dementia. So you have a continuum of care that has been changing over the past 10 years, where you have more and more people in the community with their families helping to take care of them with home and community-based services through the area agencies on aging and elder care services. A lot of services are needed, but the state has a waiting list of 58,000 people on those for community care services. So we have a lot of people who are aging in place, and we just want everyone to know who's out there watching this that a lot of people are aware of this aging population, and many of us are a part of it.
And Lou Marie, how might someone reach you?
The best way is through my email is lpwest@fhca.org.
Thank you. Tom?
Well, I would tell anybody who was looking for a residential placement that they need to be very careful, do their due diligence, do their homework and their research on the front end before they make a decision. That not every time, as I tell my students that I train, not everything that glitters is truly gold. So you kind of have to look through the surface and see what's there. I think my bigger message would be in correlation to what Lou Marie has been saying is that I really strongly feel that we need to advocate for the state to pay a little bit more money to care for the poor and indigent that we have in the state of Florida. And I think by virtue of the state doing so, you're going to see the level of care go up in some areas and some facilities because state-supported residents are very limited. So if we could advocate with our representatives and the people out there to get a little bit more money thrown in, I think we'll see a lot more positive change in our long-term care facilities.
Very good. And now, how can people reach you?
People can reach me easily by going to my email, which is all small caps tomc@tomcampbellalftrainer.com.
Very good. And I want to thank both Lou Marie and also Tom for making the time to be with us today to share their personal experiences and also this valuable information. And I also want to thank our studio audience for making the time to be with us today. We do thank you.
Thank you, Serena.
Thank you.
Selecting a care facility is a complex process that can often be an emotionally draining experience for families as well as for the person moving into a care community. Making the best selection possible requires planning, research, and much discussion between family members and representatives of any care facility. Thank you for watching today's forum, and I hope you've learned more about how you can help family members successfully transition from living in familiar surroundings to living in a new communal setting. The Vital Living Forum is part of Orange County's Vital Living block on Vision TV. For more information, please visit us on the web at www.orangetvfl.net, or please contact the Orange County Office on Aging at 407-836-6563. I'm Serena Fisher. Thank you for joining us.